Welcome to the Getting Healthier Together module on health risk reduction. This video can help you understand the purpose of reducing health risk factors, learn what health risk factors relate to specific health conditions, find ways to reduce health risks, understand the connection between a healthy lifestyle and reducing health risks, and create an action plan for yourself. What are health risk factors and why should we reduce them? When we're talking about health, a risk factor is anything that makes it more likely that we'll develop a medical condition like diabetes or heart disease. A risk factor could also make a condition you already have get worse faster. Here's a question for you. Do you suppose that people can eliminate some of their health risk factors? Take a moment to think about your answer. If your answer is yes, you're right. The key here is the word some. While some risk factors like age, heredity, gender, and race can't be changed, you may be able to control other risk factors to reduce your chances of getting heart disease, diabetes, and stroke. The purpose of this video is to explore the health risk factors that can be controlled. Did you know that a lot of chronic diseases, like diabetes or heart disease, as well as strokes, that affect the U.S. population may be avoided or delayed by people reducing their health risk factors? Because many Americans have one or more of these conditions, risk reduction programs that focus on these areas can improve quality of life and productivity, reduce the impact of disease, and extend the healthy lives of individuals. In Part 2, we'll be talking about what health risk factors relate to which specific health conditions. What health risk factors are related to which specific health conditions? High cholesterol is one of the major risk factors for heart disease. Decreasing cholesterol levels can lessen the risk of heart disease, heart attack, or stroke. Deposits of cholesterol can lead to making plaque. Plaque is a substance that narrows blood vessels, reduces blood flow, and can lead to blockage. A blocked blood vessel going to the heart can cause a heart attack, and a blocked blood vessel going to the brain can cause a stroke. There are 3 risk factors that can't be changed that can lead to high cholesterol: heredity, age, and being female. If your parents have high cholesterol, you are more likely to have it too. As we age, LDL levels tend to rise, especially after 60. For females, after menopause, women are likely to have higher LDL levels than men. See if you know the answer to this question. Yes or no? Do you suppose that high cholesterol has symptoms? If your answer is no, you are correct. High cholesterol has no signs or symptoms. That's why it's so important to ask your healthcare provider how often you should have your cholesterol checked. For some people, it may be every 5 years. For others, the healthcare provider may check their cholesterol every year or even more often. The factors that can put you at risk for high cholesterol are being overweight, too much fat in the diet, using tobacco, not getting enough physical activity, and not taking medicine as prescribed. Too much stress may put you at risk for high cholesterol because stress can increase some activities like eating an unhealthy diet, smoking, and not exercising regularly. The good news is that all of these risk factors for high cholesterol are under your control. We'll leave high cholesterol for now and move ahead to high blood pressure because it's one of the most common health problems healthcare providers diagnose. High blood pressure can cause other health problems like heart attack, heart failure, stroke, and kidney disease. Your blood pressure can be checked by your healthcare provider, or you can check it yourself by using a standard or electronic blood pressure machine. Your blood pressure should be checked at least once a year by your healthcare provider. Normal blood pressure for most people is 120/80 or less, but your healthcare provider can tell you what a healthy blood pressure is for you. There are three non-modifiable risk factors that can lead to high blood pressure: race, heredity, and age. High blood pressure tends to occur more often, earlier, and be worse for African Americans. For heredity, if your parents have high blood pressure, you are more likely to have it too. For age, the older you get, the greater the risk for high blood pressure. Here's another question for you. See if you know the answer. Yes or no? Do you suppose that high blood pressure has symptoms? If your answer is no, you're right. High blood pressure doesn't usually have symptoms. We may not know whether we have high blood pressure until our blood pressure is measured. People who have extremely high blood pressure may have a headache, blurred vision, chest pain, dizziness, nausea and vomiting, and/or shortness of breath. The factors that can put you at risk for high blood pressure include being overweight, because the more you weigh, the more blood you need to supply oxygen and nutrients to your tissues, and using tobacco, because the chemicals in tobacco can damage the lining of your artery walls. This can cause your arteries to narrow, increasing your blood pressure. Risk factors also include not getting enough physical activity, because lack of physical activity also increases the risk of being overweight, and drinking alcoholic beverages, because over time, heavy drinking can damage your heart. Having more than 2 or 3 drinks at one time can also temporarily raise your blood pressure. High levels of stress can lead to a temporary but dramatic increase in blood pressure. Not taking antihypertensive medicine as prescribed can increase the risks, as can too much salt in your diet, which can cause the body to retain fluid, which increases blood pressure. Too little potassium in your diet can increase the risks. If we don't get enough potassium in our diet, we may accumulate too much salt in the blood. Again, the good news is that all of these high blood pressure risk factors are under your control. Let's move ahead to high blood sugar. High blood sugar, or blood glucose, is a condition in which the blood sugar level is higher than normal, but not high enough to be classified as type 2 diabetes. It's sometimes known as prediabetes, a stage that often occurs before diabetes. People with high blood sugar, or prediabetes, increase their risk for diabetes, heart disease, and stroke. With diabetes, the risk for other complications, such as kidney disease, nerve, and vision problems, are also increased. There are 3 non-modifiable risk factors which lead to high blood sugar that you can't control: family history, race, and age. If you have a blood relative with diabetes, your risk for developing it is significantly increased. People of African, Asian, Hispanic, and Native American descent have a greater risk of diabetes. The older you are, the higher your risk. Do you suppose that high blood sugar has symptoms? As with high cholesterol and high blood pressure, the answer is no. People often don't know they have high blood sugar. There are no symptoms, and prediabetes can only be diagnosed by a healthcare provider using a blood test. If you have high blood sugar, even though you don't notice any symptoms, damage to your body may be happening, like increasing your risk for heart disease, stroke, and diabetes. If you have diabetes, you may have symptoms, such as increased thirst, need to urinate, blurred vision, or a feeling of being tired most of the time for no apparent reason. The factors that can put you at risk for diabetes or prediabetes include being overweight. If you're 20% or more over your optimal body weight, you have a higher risk of developing diabetes, especially if the excess weight is around the waist. Using tobacco is a risk factor, as is not getting enough physical activity. Exercising less than 3 times a week is a risk factor for diabetes. Being more active also lowers blood sugar levels by helping insulin to be more effective. Drinking alcoholic beverages is a risk factor. Drinking too much alcohol over time increases your risk. Stress may be a risk factor for diabetes if it causes eating an unhealthy diet, smoking, excessive use of alcohol, or lack of exercise. Not taking medicine as prescribed is a risk factor. If your healthcare practitioner prescribes medicine for high blood sugar, it can only work if you take the medicine as you're instructed to. High blood sugar increases your risk for diabetes. Again, the good news is that all of these risk factors are under your control. As a matter of fact, with high cholesterol, high blood pressure, and high blood sugar, not only are many risk factors under your control, but you're the key person who has the power to control them. In Part 3, we'll be talking about ways to take control and reduce your risks for developing these health conditions. How can you reduce your health risks? You know that there are health risks you can change, but there are also health risks you can't change, like your age, gender, heredity, and race. You may be wondering what use it is to know about risk factors that you can't change. The reason it can help you to know whether you have any of these risk factors is that if you do, you can be even more careful that you don't add more risk factors. For example, if you know that you're at risk for diabetes because one or more of your blood relatives has diabetes, you know that it's especially good for you to take extra steps to avoid risk factors you can control. High cholesterol is one of the major risk factors for heart disease and stroke. High blood pressure is one of the major risk factors for heart attack, heart failure, stroke, and kidney disease. High blood sugar is one of the major risk factors for diabetes, heart disease, and stroke. Complications of diabetes may include kidney disease, nerve, and vision problems. So, when you reduce the risk of having high cholesterol, high blood pressure, and high blood sugar, you're really reducing the risks of having these other conditions. There are many ways to reduce the health risks you do have power over. You can keep your blood pressure, cholesterol, and blood sugar at normal levels, eat healthy, lose weight or stay at a healthy weight, get regular exercise, not smoke, reduce your stress, and take any medicines that have been prescribed for you. Remember that since high blood pressure, high cholesterol, and high blood sugar often have no symptoms, you might not know if you're at risk. That's why it's important to see your healthcare provider every year to be checked out and see how you're doing. What are some of the things you should consider asking your healthcare provider so that you can take an active part in avoiding health risks that you can control? If you like, pause this video now for a few moments to think about this question. When you're ready, continue playing the video. Here are our suggestions. Maybe you thought of other questions as well, but these are a good start. Make sure to ask your healthcare provider what your blood pressure, cholesterol, and blood sugar levels are. Ask if your weight is healthy or not, and also ask for suggestions about what you should be doing to avoid risks. In Part 4, we'll be talking about some lifestyle changes that can help reduce health risks. What lifestyle changes can help you stay healthy? There are 6 general areas that make up a healthy lifestyle. They are regular exercise, managing weight, eating healthy, reducing stress, taking medicine as prescribed, and not smoking. Getting regular exercise lowers your health risks, gives you better muscle tone, and can make you feel like you have more energy. Here's a question for you. Which of these activities do you suppose qualify as exercise? Walking, gardening, stretching, reading? Take a moment to think about your answer. Regular exercise is any physical activity that you can do almost every day. So, simple things like walking, gardening, and stretching can be considered exercise. You'd have to be doing something more active at the same time for reading to be considered exercise. Choose exercises you enjoy and add them to your daily routine. Choose different types of exercise. Endurance or aerobic exercise such as walking and dancing make your heart beat faster. Balance exercises help prevent injuries from falls and help strengthen body areas such as the upper thighs. Flexibility exercises such as yoga and stretching increase your range of motion, help keep your joints flexible, and reduce your chances of injury during other activities. Strength-building exercises such as lifting weight and using resistance bands make your muscles stronger and help to preserve strength, independence, and energy. Start slow and try to exercise most days of the week. See if you know the answer to this question. What do you suppose is the recommended amount of time to spend exercising? 10 minutes a day? 30 minutes a day? An hour a day? What do you think? If your answer is 30 minutes a day, you are correct. You can break it up into 2 15-minute sessions if that fits better in your day. You may want to join an exercise class or exercise with friends. Your exercise plan should include talking with your healthcare provider to make sure you're making safe changes, keeping track of your exercising habits, sharing your progress with your healthcare provider, and changing your exercise goals when necessary. Please remember to talk with your healthcare provider before you start any new exercise program. The second lifestyle area is managing weight. Being overweight or obese is more of a problem than how you look. There are a lot of serious medical conditions that have been linked to being overweight and obese, like heart disease, high blood pressure, high cholesterol, or too much fat in the blood, stroke, and type 2 diabetes. Being active and eating healthy are the keys to losing weight. If you do want to lose weight, plan to lose slowly. A good goal is to lose about half a pound to 1 pound a week until you reach your healthy weight. Please talk to your healthcare provider for suggestions about losing weight safely. The third lifestyle area is eating healthy. Healthy eating can help lower the risks for developing high cholesterol, high blood pressure, and prediabetes, and help you maintain a healthy weight. This can lower your risk for heart disease, diabetes, and stroke. Please talk with your healthcare provider before making any changes to the way you eat. Changing how you eat is a lifelong process, but you can start by taking small steps. Healthy eating means eating a wide variety of foods that are low in sodium, fat, and cholesterol, having a balance among food groups, and eating in moderation. Eat a variety of nutrient-rich foods. Your daily food selection should include bread and other whole grain products, fruits, vegetables, dairy products, and meat, poultry, fish, and other protein foods. Try to eat more fruits, vegetables, grains, and beans, and eat less red meat and fast food. Here's another question for you. Besides eating foods that are healthy for you, what's another part of eating healthy? Never eating sweets? Skipping breakfast so you can have a bigger lunch? Watching the portion size, even of healthy foods? Take a moment to think about your answer. A healthy eating plan includes having moderate portions and not skipping meals. Keeping portion sizes reasonable makes it easier to eat the foods you want and stay healthy. Balance your food choices over time. Not every food has to be perfect. If you eat a food high in fat, salt, or sugar, select other foods that are low in these ingredients. If you miss out on any food group one day, make up for it the next. Your food choices over several days should fit together into a healthy pattern. A healthy eating plan should include talking with your healthcare provider to make sure you're making safe changes, keeping track of changes to your eating habits, sharing your progress with your healthcare provider, and changing your goals when necessary. The fourth lifestyle area is managing stress. Many people feel stress at some time in their lives. When you have to deal with more things than you're used to, or things you don't expect, it can cause stress. It can be due to many different causes, like family problems, life changes like having a baby, work, money issues, or having a health condition like diabetes. Everyone handles stress in a different way. What may cause stress for one person may not cause stress for another person. It isn't known whether stress causes heart disease, but acute and chronic stress may affect other risk factors such as high blood pressure, high cholesterol, overeating, smoking, and lack of exercise, all of which increase the risk for heart disease, diabetes, and stroke. To help you relieve stress, you can try to relax and reduce the amount of tension you feel. Try to think about what causes stress in your life and then try to avoid those causes if possible. Find time to do things you enjoy, like taking a walk, listening to music, going out with friends, or reading a good book. You can also take a few slow, deep breaths. Stop and count to 10 before you react or say something. Take a warm bath or shower. Meditate. Do yoga, or talk to your healthcare provider for help. The fifth lifestyle area is taking medicines, if any have been prescribed to you. Medicines are often prescribed for helping people control high blood pressure, high cholesterol, and sometimes high blood sugar if there are symptoms of diabetes. For the medicines to work properly, it's important to follow all instructions from the healthcare provider or pharmacist. If you get a new prescription, ask your healthcare provider or pharmacist these 6 questions. What's the name of the medicine? What is it for? How should I take it? When should I take it? What are the possible side effects? What do I do if I miss a dose? What do you suppose might be a good way for a person to remember to ask all of these questions? And how about remembering all of the answers? Take a moment and think about what you might suggest. If you like, pause the video briefly while you think. You probably thought of suggesting that a person could make a list of the questions and then write in the answers while they're still with the healthcare provider or pharmacist. That way they can check their understanding of the information. There are a few more tips for taking medicine as prescribed. Read and make sure you understand the directions on the prescription bottle label. Let your spouse or family know what medicines you're taking. Keep a list of your medicines in your wallet or purse and go to one pharmacy for all of your medicines. Use a pill box to help organize your medicines. And if you can't take medicines as prescribed, please ask your healthcare provider or pharmacist for help. The 6th and final lifestyle area is smoking. In brief, smoking is the #1 preventable cause of premature death in the United States and may cause lung cancer and many other health problems. In Part 5, we'll explain how you can use a personalized action plan for reducing health risks. An action plan is like a roadmap. It turns the decisions you make about what you want for yourself into practical steps for getting where you want to go. There's an action plan for reducing health risks handout that's available to you, and it looks like this. You'd begin using the plan by reading through each of the choices to see which ones might interest you most. The choices on the action plan for reducing health risks are organized into sections, including Get your numbers, Decide to eat healthy foods, Stop smoking, Control stress, Keep moving, and Take medicines as prescribed. The idea is to choose the action items that you want to do. You can also write in your own goals in the other section of the handout. You may be tempted to check off a lot of the boxes in the list, but it's better to start off with just one or two. Lifestyle changes are made one step at a time. If you're overwhelmed with too many changes at once, you're less likely to reach your goals. You can always add more goals later as you continue making changes that move you towards the better and healthier life you want. When you're finished making your choice, there are 4 questions for you to ask yourself based on what you selected. You've already answered the first question, which is, what behavior would I like to change, based on which checkboxes you've selected. The second question to ask yourself is whether you believe that it's possible for you to do the things you've selected. Answer with a yes or no. The third question to ask yourself is, what must I do to achieve this change? Make sure that you identify a specific action that goes with what you want to change. For example, if you chose that you want to get your cholesterol checked, decide by when you want to accomplish that. Write your method for measuring whether you've reached your goal in the space provided on the action plan. Deciding how you'll measure your success is a very important part of this process. The fourth question is, when will I make these changes? Think about how long you think it'll take you to make this change in your life. Then write the date for when that'll be in the space provided. The last step for creating your personalized action plan is to select your confidence level for making the change you've decided to make. To do this, select a number from 1 to 10 for how confident you feel that you will follow your action plan. A confidence level of 10 would be the most confident, and a 1 would be the least confident. If your level of confidence is lower than 7, think about choosing something else on the action plan, or maybe giving yourself a little more time to make the change. There's one final handout that's available to you, and it's called Reducing Health Risks: What You Need to Know. The handout has a summary of the key points from this video, and we hope it'll be useful to you. Thank you for your time and for participating in Getting Healthier Together.